Hi everyone, welcome to Weekend Wellness Series number 14. We started this on April 5th, thinking we'll probably go like once a week, for like 3-4 weeks. So basically this is spearheaded by Vasu, who is in town, Jaykantan, and another friend from India who's actually supporting me with all these Zoom scheduling and everything. His name is Karthik, and myself, I'm Ramki. I work as a physical therapist in RVA Physical Therapy. And the main objective of this is to educate people and provide them with more diverse knowledge during the quarantine. And also, most of us, I think, probably all the 13 presenters, and I know Dr. Vasu is also going to do this, has stressed how important exercise is during this time. So I know like my family back home initially were hesitant to do any exercise or anything, but they've all started, they listen to all this. And, it's basically, like I said, to encourage people not to go into a negative mode, instead stay positive during this whole time. And Dr. Vasu readily agreed to present this for us. So before I hand over to him, I wanted to recognize some of the speakers who have helped us go through this and share their knowledge with everybody. First, we started with Manikanta Prasad, then followed by Dr. Naveen, who is a dentist, followed by James George, Darlene Goodwin, Dr. Casey Smith, Dr. Bharati Raju, Dr. Wild, um, Arun Samuel, Shyam Sundar, Teja, Vinod, and I did my first part on the first presentation on April 5th. So once again, the purpose, what we shared or what was given to you all was to encourage positivity out of this, negative quarantine. I mean, whatever is going on with COVID-19. And also, all these topics are different. They're not the same topics. And, thanks to these speakers because they've all agreed to talk on different topics during this time. So having said all those things, I'm so happy Dr. Vasu is here today. Just a small introduction about him. I know he didn't give me much. Uh, he didn't want me to share much, but I did some research and stuff. So Dr. Vasu uh, received his master's MD in 1990 from University of Madras. He has done his general surgery residency in Penn State University from 98 to 2001. He has done a psychiatry residency in University of Mississippi. And also currently he works in the Department of Psychiatry. He's an assistant professor at VCU Health System. So Dr. Vasu is going to, our topic today is like, give me 1 second. Mental health during an outbreak. So he's going to present us on that. And Dr. Vasu, here you go.
Thank you, Ramki. Good evening, everyone, and Ramki for initiating this very good purpose of all of these meetings on a weekly schedule that keeps, most of us are homebound and working from home. It is very important for us to go through these different areas of our work schedule and knowledge to improve on. It is very important. I offer to give a topic on mental health because I work on the mental health area. So that's why we thought, okay, we will give you some idea about how this is, and it's going to give you different perspective of give you a background idea about what is mental health, just go from basic knowledge, then go a little bit detail into how this is all working with during the COVID-19. I just wanted to, there is no disclosure for me to no financial affiliation or any other disclosure I need to make. Okay, the objective of the talk today is to give an overall idea of what is mental health, like difference between a psychiatrist and a psychologist, and how the behavioral and emotional changes during an outbreak, how this affects everyone's mental health as well and physical health. And what do we know about coronavirus right now? And how we need to react and how to work with that process. And this is all overall helping us to protect us and others around us and the family and everyone. So that's where we are going to talk about today. What's mental illness? Mental illness, we give it's a health condition, we involve with the emotions. Each time when we go through certain stress and anxiety and other things, the emotion varies. Then the mind works in a way to alter our thinking and behavior, we behave in a certain pattern that causes us to either we can cope with it or unable to cope with it. To a certain extent, we are able to cope with the regular anxiety and stress. When the level of anxiety and stress goes beyond certain limit, then we become getting to the level of needing some extra help and other things. That's where we are. So during this process of when you're not able to withstand all these stress, you're not able to function regularly and not able to sleep well, and those kind of stuff happens. Mental health can affect anyone, it doesn't matter what age you are, gender, and what's your financial status and social status and what's your background. It doesn't matter. It could be affected with, anybody can get affected by it. And the good part is if you take appropriate step, it could be treated. That's why I try to don't postpone it. If you really think if you need some help, that is better to reach out to somebody than get the help or what you need. The psychiatry, as I said, I want to talk a little bit about, because I came across a lot of times between friends will be asking me between, oh, you're differentiate between doing a counseling versus psychiatrist. People here in the US, most of them, who are familiar with system, which is they reach out to psychiatry and psychologists. Psychiatry is like everyone else, having an MD degree or DO degree. We specialize in mental health and including substance abuse disorders and other things. Basically, you go through a medical school and go through a residency training where you have your understanding of how the mental health works and how it affects other people. Then you go from there. Usually, people come to us to get help for, when the depression or anxiety, or they may be having some severe anxiety problem, or maybe they may have some problems with, some of them are very serious, hearing voices, and some of them end up being diagnosed with schizophrenia. So this is all sort of people, starting from minimal level to extreme levels of illnesses, we deal with them. The psychiatrists usually, most of us these days, we prescribe medications, and we are also do psychotherapy, but most of the part is dedicated to medication prescription along with some psychotherapy. Whereas psychologists, they're also very well trained and gone through a PhD or MS masters and all of that stuff. They do counseling or psychotherapy, and also do some psychological testing and evaluation on a regular basis. Somebody needing psychological testing, that's who we refer them to go and talk to them and get the testing done, and they can identify different areas of where the problem is, so that they can give you some idea how they could be helped. Do they need some medication, or they could be just treated with just the therapy alone? That's where it comes. So some states allow the psychologist to prescribe medications, but Virginia is not one of them to allow the psychologist to prescribe a medication. And Illinois and some of the other states, they have psychologists who are allowed to prescribe, but I think to limited extent to just with the psychiatric medications. The common problem what we as a psychiatrist come across, the very common ones are the anxiety disorders. Panic disorder, it could be a generalized anxiety. The other one, like, very commonly is the depression. It could be a major depression, or somebody might be having a, low-grade depression lasting for a long time, with what we call them this as a dysthymia. And most of you heard about bipolar. Bipolar could be like, they could become manic. Manic is like, literally opposite of depression. Like, they become like, very talkative and not able to sleep, don't need to sleep because of a lot of excessive energy. It goes on for days and days. Then like, sometimes it get to the extreme of they are overtly manic and they need to be hospitalized. Or they could become depressed. That's why the term called bipolar, like, two poles, they'll go between the lows and the ups and the highs and the lows, the highs and lows. So that's why it is called a bipolar. The OCD and the PTSD, OCD is the obsessive compulsive disorder, and PTSD is for post-traumatic stress disorder. They all, they both come under the category of anxiety disorder, but like, it is a subset where there is a population, like, mainly people go to war, or maybe who went through some kind of a traumatic events, they develop these traumatic, post-traumatic stress disorder, and how to treat them, what kind of medication will be helpful, and what kind of therapy needed, and all of that stuff. Then the other one, like, schizophrenia. Schizophrenia is like, having some chemical imbalance. It starts in very early age, in their 20s, then it goes on to last for like, if they are better treated and very well can function, but the quality of life may be affected. Because of that, the family go through a lot of emotional support and like, family burden happening because of needing to take care of somebody who has been ill for going to be a long term. That's who the schizophrenics, the one, like, a lot of times we refer to people like, they're talking to themselves, like, they're hearing voices which other people cannot hear, or maybe seeing things. So that is the entity for schizophrenia. Next comes the ADHD. ADHD is attention deficit hyperactivity disorder. Mostly it is diagnosed in children. Recently they've been recognized if somebody who has been diagnosed as a child, like, go on to continue to have symptoms as an adult, then who may be needing some help with the medication. That's who take stimulant medications to help with their focus, their attention. As a psychiatrist, we also take care of childhood mental health problems, like, autism, somebody with a mental retardation, those kind of stuff. And also the children go through the regular, the depressive symptoms, like, who could become, at like, teenage years, they could get diagnosed with some of these other schizophrenia or other symptoms, as well as the bipolar. So the next one is the personality disorders. We have a category, like, some of them are, the above all, they go along with some kind of a chemical imbalance in your brain between serotonin, norepinephrine, dopamine, all of the other ones. The personality disorders are entity who we are, how we grew up with, what kind of things went along when you're growing up. As long as you're able to function and maintain your lifestyle and way of living, it is not needing to be interfering with your life, then it is okay. But it is get to the extreme of not able to function in life, that's when you need to get an attention and seek help for either through therapy, adding some little medications to help with the personality disorder. So mostly it is going to be therapy for the personality disorders. Let's talk about depression. Before I decided to talk mostly the depression and anxiety a little bit in detail than other diagnostic ones. We all go through some depression, like, sadness or grief when somebody died close to you or lost a job or those kind of stuff. the grief process is like, self-limiting. Like, sometimes it may last for like, 2 months, 3 months, depending upon who you are, how your genetic makeup is. Then you are able to come out of the loss, or maybe something better happens, then you move on in your life, then like, you're able to manage it. But in depression, if somebody has some of the same similar symptoms of feeling low, but like, not able to maintain your everyday activities, not able to sleep, like, you're able to not having much appetite, you're starting to lose weight, that's when we get worried about like, who needing help for treatment and other things. So it is normal to feel sadness, but like, it is, the being sad is not the same as having depression. These things are self-limited. You are able to come out of them by yourself. That's why, like, most of the regular everyday life events, we are able to push forward. We don't need to worry about getting a medication. But when you're not able to do that, that's when you need seeking help and medication. That's where it comes. So these are all some of the diagnostic criteria as psychiatric provider. We go through what is needed to consider whether you have a symptoms meeting for criteria for depression. We go by the DSM criteria. Like, most of these symptoms, are we having these symptoms for at least 2 weeks duration? Some of them, like, having a mild, it could be the depression could be a mild to severe. Feeling sad and depressed mood, a loss of interest, pleasure in activities, like, once you enjoy doing those things and you stop doing your hobbies, isolating yourself, changes in appetite. Sometimes you may lose your appetite. Sometimes, like, people call them stress eating, but like, they may be eating differently. And also that goes with the sleep too. They have a trouble sleeping, or they may be sleeping too much. That's that, like, that is called like, depression with atypical features. Loss of energy, feeling fatigue, increase in purposeful physical activity, like, pacing or moving, like, slowed movements and speech. You're not like, loudly talking, like, others are observing you're not doing well, like, you're isolating. Those kind of symptoms, like, which is more consistent with depression. Like, you feel like you're feeling worthless or feeling guilty of what kind of things you have done or what put you into the spot, like, that makes you more feeling low. And because of the depression lasting for weeks and weeks and months, sometimes, like, you're not able to think, your concentration goes down, you're not able to make a proper decision, which leads to think like, okay, what is going on with me? Okay, not able to think straight and all of that stuff. The extreme level of this depression goes down to when the level is getting worse, depending upon what puts you into the depression. People start thinking about, like, death or suicide. Like, that's the other form of, like, when we come across people with these kind of severity, that's when we talk about, okay, are they willing to come into the hospital voluntarily, or do we need to put them into the hospital involuntarily? Because if their safety is a very important thing, like, if somebody is not able to guarantee for their safety, then that's when we try to advise them, okay, voluntarily coming in there for the hospital until they get through this little crisis and get them started on medication and learn them coping skills. Then they could be discharged and get an outpatient follow-up and other things. Some statistics, like, people, like, 16% of general population will experience depression in their lifetime. As I said, it could affect at any time, but usually it starts in your mid-20s, or women are more likely to experience depression than men. And, like, some studies have shown, like, 1/3 of women will experience a major depressive episode. What major depressive episode means, like, not having like, full criteria, that is a milder version. But like, if somebody met all the criteria, but like, lasting for weeks and months, but sometimes like, they get through one episode, then the other episode follows after a little later on. So those kind of people, like, they meet the criteria for like, major depressive episode. That's when like, you need to be really taking care of them and continue to be on a medication on a regular basis. In children, the presenting symptom of depression, it could be different than adult. They could be more irritable, and like, they may have some somatic symptoms. They may be talking about like, they would have been fine, but like, you frequently see them talking about, I have a stomach pain, headache, like, those kind of somatic symptoms, like, always talk about, like, more and more frequently. And like, they seem to be withdrawn, not so cheerful like before, not eating well and sleeping well, like, being nervous around other people or by themselves. That's when we need to focus on, okay, what is really going on? Is there anything else going on at school level? Or is it, what is causing them? We need to sit down and talk to them. As a family, as a parent, you need to talk to them and recognize these things. And the elderly are also very vulnerable for depression. And like, these days, like, we all get busy with our own routines and going on, and like, we're thinking, okay, they're elderly, they will take care of themselves. But unfortunately, if they're not able to manage themselves, they become very isolated and they don't get engaged in other activities, what they enjoy doing it, and start losing their appetite, and they don't eat well. Of course, we need to worry about any other medical condition can be contributing to it as their early age and all of that stuff, but we need to make sure, okay, it is not a medical condition. Like, once that is ruled out, then we need to focus on, are they depressed? Do they need to get to treatment? How do you treat a depression? Like, there are, excuse me, milder version of depression, we don't need to get to the medication right away. 80 to 90% of the people with depression eventually respond well to treatment. Like, either you could be like getting into medication or therapy and all of that stuff. I'll talk on the next slide. In general, like, depression is one of those most treatable mental health issues compared to other ones. And the medication, what we prescribe, like, they help with bringing up your levels of the chemicals in the brain, like, the serotonin, norepinephrine, those kind of stuff. They're not habit-forming medications. And they have done some studies, okay, when you give some of these medication in a normal person, does it makes them excited? But that is not the case. So you don't need to be worried about, but nobody's going to prescribe you medication unless it is really needing it to help you come out of the depression. Usually how we go by, how long do you need to continue these medications once you get started on? You just see whether your symptoms resolve, and then usually, like, after resolve, like, symptoms kind of gone away, then you wait for like 6 months to 1 year after the symptoms have been improved. So you want to continue these medications for a little long term. So that's what it is very important. Like, don't, just because you're feeling better, you don't want to go and stop your medications. Of course, it's a stigma attached, like, they have side effects and other things. You don't want to relapse into depression frequently. So it is very important. You need to keep up with your medication so that you don't fall back into your depression again and again. If your depression is not getting treated properly, then that is like, the brain cells, like, not developing well, like, you're putting you more at risk of developing another depression again. Even with the milder stresses, you could really fall for those depressions. That's why you get that adequate help and treatment and medication to the things. Sometimes, like, if somebody has a very genetic makeup or maybe a family history and other things, like, several members in the family has a depression. For those kind of patients, if you identify by history, then you need to advise them for a maintenance treatment. Like, because they're at high-risk group. They need to go on a long-term maintenance medication, like, continue to take this medication as long as they need it. Okay, it's part of the thing I already talked about, like, the milder version of depression. You can go to a psychiatrist or psychologist, sometimes, like, licensed clinical social workers. Some of them, they should LCWS, they may be able to provide some counseling. Here, otherwise called talk therapy. Psychotherapy is talk therapy. That is the first step. You want to see whether your depression is mild enough. If you're able to, by going and talking to somebody, if you're able to tell your stories and other things, like if you're not able to get the depression resolved, that's a good thing, like, get started in the beginning. When the level of depression gets higher, moderate or severe depression, you continue to have the talk therapy. That's when you want to involve the antidepressant medications. These medications, like, they help you, like, replenish your depleted levels of those serotonin and other things. They help with your mood. Some kind of medication, they bring your energy level up. So that's why, based on what the history we come across, then we prescribe these medications. What kind is better for them, one versus other, that's how we decide on antidepressant medications. The psychotherapy, like, the talk therapy, sometimes, like, you can do an individual therapy, or sometimes, like, it could be done as a group. They do as a group therapy, like, they try to group some of these patients who come with the same symptoms. So they give each other support. They will be able to learning from each other, like, if they're not alone to worry about, okay, I'm not alone with this problem. There are several people with this problem. That helps them to come out of these things. They build up their self-esteem. That way they were able to come out of this depression. Other than the medication and talk therapy, we use some other non-medication treatment for depression. This is coming to, like, if somebody not able to tolerate the medication because of the side effects and they don't want to take these medications, those kind of patients, then we go into giving light therapy. So the light therapy is used, like, sometimes, like, people have a seasonal depression. When you go into fall and winter months, they become, like, more depressed. Those ones, like, they will get, like, there is a prescription light you get from the stores, and you put them on for 30 minutes every day. So that helps them to get out of this depression. The other ones are a little more invasive. TMS is that you may be hearing about this radio advertisement about transcranial magnetic stimulation. I'll talk to you a little bit about. And ECT is the one area, a little bit older treatment. It is electroconvulsive therapy. It is a olden day treatment. They call them shock treatment. But it is still being used. I'm one of the specialists. I specialize in this area of electroconvulsive therapy and TMS. So we'll talk a little bit about that. And deep brain stimulation is you go into the brain and, like, neurosurgeon places a probe in particular area of the brain where you need to stimulate for depression. They put a stimulator there and bring out a wire outside to connect it to a battery and leave it on your chest wall. Like, you can control it externally so that can give you impulses periodically. So that gets you the brain part of the thing stimulated. The vagus nerve is the same principle. You attach to one of those nerves going up the neck. You attach the stimulator through that one. They go one afferent and the efferent, like, bring about these changes. So they are a little bit more invasive procedures to do those things. Okay, this is the apart from therapy and medications, when sometimes you may be on both medication and therapy, then you may need to consider these treatments. This is the magnetic stimulation. This is like a dentist chair. You sit there, like, you identify the patient's area of the left prefrontal cortex. This is the magnet. They have a magnetic strip put in there. So once you recognize, and by identifying thumb movements and all of that stuff, you locate the brain area where it needs to be stimulated. You go through Monday through Wednesday, every day for 40 to 45 minutes. You sit in the chair, somebody with a trained professional. You get the treatment done, like, you know, it goes for 5 to 6 weeks. This is mainly done for people, mainly for mild depression, moderate depression. The response rate is maybe, I could say, around like 40%. The next one is a little more invasive, which is the shock treatment, otherwise called the ECT. The machine generates it is collected to the electrical outlet. For this one, the patient need to be under sedation by anesthesia. Without any sedation, we don't do any of these treatments. So they have to have an anesthetist present. They monitor their heart rate, vitals, and everything, and they put them to sleep as if you're going through a surgery. But it is a very short procedure. Then we connect the brain electrodes to the external surface of the brain area. Then you produce a mild electrical stimulation, which causes a seizure. So you will not know anything about what you're going through because you're under sleep and, like, you know, you're paralyzed. So you will not feel any of that stuff. So the activity, this is the seizure activity. This is before the seizure, the brain EEG activity. Then this is the seizure. You see that spiky waves. So when you do those treatments, like, you know, 8 to 12 treatment, we do Monday, Wednesday, Fridays. It is a very good treatment, but like, as soon as, because of the stigma, and as soon as you hear shock treatment, people shy away from it. But people who have had a very bad depression, severe depression, who've gone through these treatment, they prefer to go to this treatment quickly rather than waiting on a medication. This really helps quickly to pull you out of the depression. So we use this as somebody really sick and really have a very bad suicidal thoughts, a very bad depression, not eating and doing any of these things, bedbound. So those kind of patients, we use this treatment. It is being utilized, like, you know, in most other institutions these days. The next is the anxiety disorder. Anxiety is the most common. It varies from mild anxiety, mild feeling nervousness, to extreme anxiety, having a panic attack and all that stuff. This could be the most common of the mental disorders. About 30% of the population and adult population suffers from anxiety. It varies from several types of anxiety based on, like, you know, generalized anxiety, panic disorder, and specific phobias, and social phobia. And, like, you know, in children, you may be seeing some separation anxiety disorder around 2 years of age when they're getting separated from mom. So all those feelings and all of that stuff. So that need to be addressed. So because of the anxiety stimulating or provoking situation, they try to avoid these situations, which is it is an uncomfortable feeling. You don't want to deal with it. So that's why we try to avoid them. So which could interfere with your job performance and schoolwork. Sometimes, like, you know, your personal relationship can be affected. The anxiety, you feel this anticipation of this anxiety coming in the future, anticipatory anxiety, which causes a lot of muscle tension, like, you know, you're trying to avoid these behavior. That's why you do. So most of the time what happens is, like, you know, having a certain level of anxiety it's okay and normal. It is okay to do that. But it is when it is out of proportion to the situation and age, and it is inappropriate, that's when it needs to get treatment involved. The same way you go to diagnostic criteria. Many people suffer from anxiety but do not seek help. But, like, you know, if you're able to manage it without compromising your life activities and other things, then it's okay. But you don't need to shy away from getting some of these treatment, which makes a lot more easier in your lifestyle and functioning. Your quality of life will be better if you really need some help. Most of them respond well to psychotherapy, and sometimes we use the anti-anxiety medication and antidepressant medications. For anxiety problem, like, you know, there is a specific therapy they use in cognitive behavioral therapy, which is the cognition is how you think, the behavioral is how we perform and do certain things. So some other people, like, you need to work on the cognitive, the thinking process. You need to think it differently, how to modify the thinking and all of that stuff. Then you work on the behavior part, like, then you see, like, okay, what kind of behavior you're doing, even though your cognitive function is well doing, then that's when you need to modify. It's cognitive behavior therapy. A lot of times we use anti-anxiety medications. A lot of other people back home and here, they may be using it, like, this is the benzodiazepine group of medications. They are generally prescribed for a short-term use. They work well when you needed them acutely, but it is habit-forming qualities. That's why you need to be very careful with them, like the Xanax or Ativan or the Klonopin or Valium. Those are the ones comes under the anti-anxiety medication. So you need to be a little bit careful, but it is okay to use them when you really needed them, but use them short term, but be careful when you need to be, because they are very heavily dependent formation. That's why you want to avoid them. You don't want to get dependent on them. Anxiety and depression, they go hand in hand. That's why even the most of the anxiety problems, we treat them with the antidepressant. So you try to start them on an antidepressant, they take a little more time, like 4 to 6 weeks for them to build up in your system. In the meantime, you can use some of these medications to help get through your anxiety. Once this level of antidepressant builds up in your system, you may not need that much of an anxiety medication, the benzodiazepine, then you can slowly wean down on them. We use prescribed beta blockers, which is cardiac medication, sometimes to reduce your heart rate and blood pressure. That could be used for performance anxiety, those kind of certain situations. We use that to help with the performance, so that you don't be feeling nervous and all that, you can perform well. Other coping skills and managing anxiety, we should always, we are focusing on yoga and mindfulness techniques and meditation. These are all the ones to focus on. You bring back your reality, and the mindfulness technique is very helpful. A lot of people, now it is becoming very popular along with the yoga and other things. A lot of people do that. Then there's support groups you have. There are some in-person or online support group you can get into. Opportunities to share your experiences and coping strategies, how they dealt with it, how they managed it. So you can learn from the others, and you can teach the others, how you manage some of these things in a helpful way, so they're helpful. We tend to use caffeine, or people go to smoke when I'm nervous. It is not a good idea to continue to do that, because the chemicals involved with anxiety, or the epinephrine or norepinephrine, or those kind of stuff, these gets elevated by using caffeine and nicotine. So you better avoid these things, because these things can increase your anxiety and panic symptoms when you smoke or drink a lot of caffeine, other things. Avoid those things. Okay. Because of, we brought up all of these things because of the coronavirus, and I just want to give you quickly go over. I know you already had several times in the last 3 months heard about this. The coronavirus family has been there since 1930s, and most of them are respiratory infection producing viruses. The human coronavirus was first discovered in 1960. The recent one is the one discovered, it never been, and this is a new strain that was discovered in 2019, has not been previously identified in human. That's why it is called COVID-19. They put it as the coronavirus diseases 19. So the COVID-19 is when you have the full-fledged disease, then they call them COVID disease. The virus itself is a coronavirus. Again, as I said, most of these involved with a serious respiratory tract infection. Then the WHO declared as a pandemic in March of 2020. The virus usually spread by having a close contact, and it usually spreads by small droplets. When somebody is coughing or sneezing, or when somebody is talking, that's why they want to have it 6 feet distance from other people so that it doesn't come close to you. It can get dropped so that you don't contaminate by yourself. That's why they're talking about so much about social distancing, and it is like more like a physical distancing along with the social distancing. You need to be a little bit away from the other people. That's why you need to give space. We have to really follow these things. We are not out of the woods yet, but we don't have, even though with the social distancing, other things we maintain, like, the infection rate is kind of slowed down, but now they're slowly easing up into these things, and we don't know how everybody is worried about how this is going to come out. Usually the symptoms, like, the virus can survive on the surface for up to 72 hours. That's why you decontaminate if you commonly touch surfaces like, doorknobs, keys, and other things. If you have, like, you don't need to go overboard, but, like, use your common sense to keep yourself clean. Wherever a lot of hand washing, so that before you put your nose, mouth, and all of that stuff, that is very important, so that you don't want to touch something and bring it to your nose, or touching your nose or mouth, and then you get infected with that virus. These are some of the symptoms, like include fever, cough, and shortness of breath. I think this is the minimal symptom. They end up with acute respiratory distress syndrome. Now they are coming up with, it is not just the respiratory syndrome and pneumonia, like, because of the shock, it is releasing a lot of these interleukins and toxins, which causes the blood, your coagulation system in the blood system, producing a lot of thrombotic and emboli, like, blood clots, minor small blood clots, which is affecting your lung circulation. So still people are trying to come around. Okay, they're still working around to see what is the best way of handling this illness once you acquire them. And the treatment, other than that, like, no known vaccine yet. They are still, keep hearing from the media, and everybody is talking about it. They're trying different antiviral medications. Nothing has to be proven. So the main thing is to use the preventive measures, including hand washing, covering one's mouth, and, like, cover your cough, and, like, isolate yourself and protect you and your family and others. That's what we need to do at this point. Okay, how an infectious disease outbreak like a corona, and how it affects us mental. Whenever something unknown and never been there, it is pretty new, we get fearful about this. So the fear and uncertainty heavily influence our public behavior. Like, we try to, like, overwhelm ourselves, like, that's you already seen, and everybody is being quarantined, and, like, it's going to be very difficult to carry over, like, lifestyle has been so much changed. It is not just here, like, it is all over the world. So we need to see what the best way you can protect yourself and your immediate, and not to infect the neighboring people, like, close to you. That's what we need to do. Sometimes, like, we are worried about, like, okay, what is going to happen to me, and personal protections and other things, and what is going to, okay, if I get it, what happens to my family? So these are all the fear-provoking situations. You start worrying and panicking about it. So then there comes, we all did, like, okay, if I get it, I need to go into isolation. They put you in quarantine. Like, what is kind of a treatments available that could be used? That they become very uncertain situation. We have to pay certain trust to these institutions, which is responsible, like the CDC and WHO. And media, sometimes it is useful, like, it is already, nobody knows specifically, because each media, like, supports one and propagates other things. That's why we need to get a lot of misinformation. So we have to be very careful about what information, how much of information you're gathering from the media or the other social sites. You want to just limit yourself with limited information, like, gather the correct knowledge, and don't get overwhelmed with every little information every 30 minutes looking into these details and all of that stuff. When we are kind of psychologically affected and behavioral responses come to infectious disease outbreaks, Like, we are not able to sleep well, we reduce feelings of safety, and like, increase use of alcohol and tobacco uses. Like, then we start looking into, okay, do I have the symptoms? Like, looking at a lot of these Google searches and all of that happening. So that's what happens, like, in which automatically increases your anxiety there. And we want to have a timely and accurate information from whenever have this in any kind of an infectious disease outbreak, not just necessarily just the corona, like, we want to see. These play a critical role in managing the fear and uncertainty. So that's why it is very important, like, like now they have this task force from the White House and other things, like, supposed to give you the clear information, like, the CDC, WHO, they're all the trusted people who are there. They have like more information, not just here, they gather the information all over the world so they can get you the right information. You can look at those sites instead of having several other social sites, like, then you're getting a misinformation. So rely on those information. Educate ourselves, like to follow a good hygiene to reduce spread of the illness, hand washing, covering your cough, and all of that stuff. It is very important. It is normal to feel stress, like, whenever there is an infectious, it is once you have yourself, like, able to have a little bit of idea about what is happening. Between 2 months ago and now, we have a little bit of better understanding and trying to accommodate to these kind of lifestyle changes. So that's how it is going to happen. Until, like, we have a definitive answer scientifically, then it is going to go through some kind of a fear will be there. Again, like, we talked about this limiting the media exposure. Like, you want to gather the information from the correct sources, but don't get overwhelmed with, like, having every information from the news media, getting it. If you're not able to handle them, just turn it off. Just get once in the morning, once in the evening, like, maybe 10 minutes, 15 minutes, get the news and, like, and turn it off. Other things to, recommendations to minimize this, like, keep a routine, normal routine for ourselves. Like, just because you're working from home, you don't need to have a long, like, your sleep changes and all of that stuff, but you try to have a routine, like, as if you're going to work every day. So that way you're having a routine formation of, like, it's not disturbing your regular work every day, your physical and mental well-being. For children, like, everybody is worried about, like, what happens, how do I know? They know very well, like, what's happening, but, like, just do not ignore them, like, hear from them, ask them, like, what's going on, what is the understanding of COVID, what is going on right now. But not every child is, like, able to handle these things, like, just walk away. Some of them are very fearful, very scared of these things. You just hear them out, like, just support them, and, like, give them a good discussion, healthy discussion. Like, tell them, like, limit their screen time of watching these kind of exploring into these things, because everybody has a smartphone access these days. So that's how you want to manage with the children, like, support them. And try to focus on enjoyable activities, like, whatever it could be for you. Like, each person's lifestyle is different, but, like, focus on positive aspect of your life, like, having a good family time together, and having a routine physical activity is very important. Like, Ramki was saying about, we focus and stress on physical activity. It's not necessarily just walking, or, like, it could be any means of physical activity. I see a lot of them doing a lot of gardening work, outdoor activities, and people are making, like, home improvements. So it could be anything on your own, like, keep yourself busy physically. That helps with the mental health. Each time when you have a lot of physical activity by exercise or walking or doing and jogging or running, your endorphins get released, which is kind of a reward center, as well as, like, reward hormone in your brain, like, helps with you, keep you upbeat and, like, doing better with your mood and everyday activities. Spend family time together. It will increase your feeling of safety and provide like, helpful opportunities to talk and share. Like, you bring back your old stories. WhatsApp has been pretty good these days. I think like, there are several groups, family groups and classmate groups, elementary school groups. So there is a lot of ways you can keep up with them and engage them these days, like, which is going to, you don't need to be physically there, but like, by being on electronic modes of communicating, that you could keep you busy and like keep you connected. Other things you can do is like, music, reading, sports, and other hobbies, what you like and you could be engaged in, that could be recommended for like, keeping yourself occupied and busy. Keep up your like, basic needs, hydrate well, eating healthy, sleep regularly. Take breaks, like, rest and relax activities, lacking activities, but very helpful, like, distracts from other things. Stay connected, we talked about it. Support from family, friends, colleagues, and like, reduce the fear of being isolation. Stay updated, rely on the trusted sources we talked about, and like, a lot of the workplaces, they themselves provide work meetings, not necessarily related to your work, like, during this kind of stressful situation, they bring in a specialist to talk about how to cope with the stresses. If there is anything available, please participate. So that will give you some helpful hints so that you can pick up some of these things you can put into your life. Self check-ins, like, monitor yourself for signs of increased stress, and like, talk to your family member or friend, or even to your supervisor. How are they feeling? And if you feel like, something you need to convey to somebody, so you need to bring it up. And this one is like, you honor service, like, you remind yourself it could be important to your work, what you're doing. And also, like, if you see somebody, like, recognize the others, like, who are doing a good job and other things, recognize them for their service and other things, like, frontline works these days, like, healthcare workers and all of that stuff. So they're putting their life at risk, like, doing this service. So try to recognize them and honor them as well. I put a couple of apps which could be useful for managing your anxiety and like, mindfulness and all of that stuff. You could use some of these things, like, these breathe to relax is like, a lot of times you deep breathing exercises to help with your anxiety and stress. So a lot of people uses them. The mindfulness coach is kind of, it's like an online, it is used in a lot of the Veterans Affairs hospitals and other systems. They use this one. They're very helpful tools to some of these apps you can look into. I think the overall, like, the point is, take home point is like, be aware what's going on, contain yourself, and keep up yourself with the physical activities and everyday routines. And like, we need to stay safe. That's how we need to get through this one. I think stay safe and be healthy. I think we covered a little bit of information about what's going on with the COVID-19. Thank you for everybody tuning in at this time. And I want to thank Ramki and Vasu Sanmugam for initiating this organization. And Ramki, thank you again. Hello?
Yeah. Ramki, I think you're talking in mute. Ramki?
Oh, Vasu.
Hello, doctor. How are you?
Good, good. Thank you, Vasu. Where were you? We were thought like, you're not there in the beginning.
No, yeah, I got sucked into another. Okay. Thank you very much. I think Ramki normally finishes this. Let me open up the forum for any questions.
Mm-hmm. Anybody has any questions?
Those who cannot talk, maybe you can, type your questions in the chat. I can read them out.
Maybe it is too good, Vasu. That's why nobody has questions at this
Yeah,
point.
we need to be in a level to ask questions. That's right. But it was really nice. Even Sandhya was listening the whole thing. It's really
Thank you.
very informative. Thank you.
Oh, thank you, Sandhya. Thank you. Thank you, everyone. Anyone else has any questions or we're good?
I'm sorry, my line got cut. So
Okay,
I'm back now.
Okay.
So thank you so much, Dr. Vasu.
You're welcome.
I think the recording went on, so it didn't pause or anything. Guys, any questions? I know you guys have started asking questions. Sorry, my system went into a restart mode. So there's a couple of chat messages, Vasu.
Yeah, you can read to me what it is because I didn't hear any question yet.
So Vasu, the innovative methods of that ECT and the latest method that you shared, they were very informative, because I don't think all of us as a individual, even in healthcare, we only know of that ECT part.
Yeah.
But the latest technology that you talked about, I mean, that's amazing. That's really good.
Yeah, that's why I brought it up. I think this is just to generally promote an idea about what is going on, because unless you go into that particular problem, we don't need to deal with these things.
Yes.
And especially us from our background, cultural background, unless you are really needing it, we're not getting there. You're kind of shameful about it, getting help, all of that stuff. That's why it is very important. You don't want to keep postponing these things.
Exactly.
So you want to get to the help so that before it gets worse.
Yes. And another information was like how you talked about, towards the end, what all we can do to prevent depression, especially during this time, talking to your friends, talking to the family, and, going into, following some, doing some sporting activities and stuff.
Yes.
I think those were very informative.
Yes. Thank you.
Thank you. Sandhya has a question. Vasu is not asking.
Go ahead, Sandhya.
Yeah. Hey, can you hear me?
Yeah, I could hear you, Vasu.
Yeah, Vasu, Sandhya has a question.
Yeah. Hi, hello, Sandhya.
Hello, how are you?
Hello, good. How are you?
Your session was very informative. I really enjoyed your session. I have a question. How do we differentiate the tummy ache that kids have, whether it's a regular tummy ache or is it related to depression?
The thing is, the regular tummy ache, when you have some of them, in the beginning, if it is not there before all of these things started, then this is all coming up because of what is happening now. That's when you start worrying about it. You didn't have these kind of symptoms before. As a child, growing child, has regular, as a mom, those things. Now you're seeing, increase in the intensity of these things and the frequency. That's when you need to start focusing and worrying about it. And also, you want to see, is there, I think we don't want to assume everything is psychological. If there is a tummy ache, you want to make sure you've seen your primary care or pediatrician, make sure there is nothing else is going on. We don't want to miss a appendicitis, which is we don't want to burst open there. So we want to make sure those things are ruled out. Then you want to think, okay, this is psychologically going on. That's what it is. When you are not able to physically pinpoint something, that's when we come down to the psychological part.
Okay. All right. Thank you.
Yeah. Okay.
Thank you.
You're welcome.
Thanks, Vasu.
You're welcome.
Anyone else?
So Vasu, this is Selva.
Oh, Selva, how are you?
Good, good. How are you? It was really useful.
Okay,
it was really complete. Got a lot of information. Thank you.
You're welcome.
Quick question. Is procrastination a form of mental disorder?
Procrastination, it is not a mental disorder, but maybe how much you procrastinate is it could become a problem for not able to keep up with life.
Okay.
It is not like a mental health disorder. There is this entity with the ADHD we talked about, right?
Yeah.
So the ADHD, there is also an inattentive type. People are not able to focus and pay attention and all of that stuff because they are not able to pay a lot of attention. They tend to procrastinate things and keep it to the last minute. Then they cram in too much into it. Then they're not able to cope with it. That's when they feel the pain and pressure and all of that stuff. Some people are very well capable of able to manage it at the last minute, but depending upon who you are, what you can do, that's what going to dictate whether it is procrastination is going to be okay for you or not okay for you, that you need to work on it. If somebody cannot work at the last minute, it produces a lot of anxiety and stress, then that is not for you. Then you need to be pre-planning things, put it on a schedule and a, like, you know, regular pattern, and then you need to get to the bottom of it before it gets worse.
Okay, thanks.
Okay. Any other questions?
Any other questions, guys? Vasu, looks like no other questions that came up on the chat too. So
Okay, no problem.
yeah. So excellent, Vasu. Thank you once again for your time and the knowledge. You know, and we're gonna keep continuing this at least till June. Next weekend we don't have any sessions because of long weekend, but we are starting with stem cell regenerative therapy on Saturday. I think it's the week after, I mean 29th or 30th, something like that, and then we'll go from there. And as I said, like, you know, this session is going to be posted on Facebook page by tomorrow, and anyone can access it and you know, learn from it. So please share it with your friends and family. And you know, it's probably the right time for all of us to share the knowledge, because most of us are at home right now. So especially there is one person that I'm seeing right now who I woke up and he's smiling right now. He's ready to get everything open. Unfortunately, he is controlling himself right now. So
okay.
Yeah.
Hey,
Good.
Vasu, thanks a lot for a very informative evening. Thank you very much.
Yes,
Thank you.
yes, Vasu. Thank you.
Thank you.
Thank you.
Thank you.
Thanks,
Bye-bye.
Vasu.
Okay, bye.
Bye-bye.